Hello, my name is Kassandra Barrera, and today I'm going to be doing my project on a eating disorder. Specifically, I'm going to be focusing on a disorder called Bulimia nervosa. For my project, I did decide to do an art piece. So let me show you guys my art piece. Right now, I'm just going to state what is depicted in this artwork. So my project is divided into two, one with a more happy background and one with a more sad and depressing background. And it was meant to do that to show the contrast in how these two women portray themselves. So the woman behind the yellow background is more a content woman. She has pink eyes, which in my case were used to depict how satisfied she is with her body looking like this. But because she is so caught up in trying to perfect herself and getting skinnier, in the end, she ended up seeing herself as someone who is bigger and something that she does not want to be. No matter how much weight she loses, she will always see herself in this physique. I decided to use black to show poor dental health because, as you know, people who have bulimia nervosa often make themselves throw up to keep themselves more fit, and because of that they often have dental problems from all their acid reflux that comes back onto their teeth and basically grinds down on their teeth, which makes them unhealthy. That's why I drew them black on both. And in this picture, I also want to highlight how this person in this background is not satisfied with the way she looks, which is why she is leaning more towards this side, the negative side, and this side is leaning towards more the positive, yet it's not as positive because she is currently experiencing a more thin look that is in the end not very good for her, which is why I decided to do extremely tiny and very thin arms to show that right now she is in a very good physique, but she is now transitioning into a more anorexic look, which is no longer good for her. So now I'm going to be talking about like eating disorders, what it is. So eating disorders are serious mental health conditions where people have unhealthy thoughts and behaviors around food, body image, and weight. They can deeply affect a person's emotions, health, and daily life. So I chose this theme for my artwork because I want to raise awareness about how painful and misunderstood these disorders can be. Many people suffer in silence, and I believe it's important to show the emotional struggle behind the illness. To understand it better, I did decide to look into a couple of sources, which helped me learn more about the deep psychological and emotional effects of eating that eating disorders have on people. So according to a Google Scholar source that I found called Hormones and Behavior, they mentioned that almost all people with eating disorders are women, and despite decades of research and treatment efforts, recovery outcomes still remain poor. Studies show that fewer than 50% of individuals recover within 10 years. Around 25 become chronically ill, and relapse is very common, often within a year, even after a partial recovery. So because of this eating disorder, eating disorders are often considered chronic illnesses. Research has shown that many commonly used treatments, including behavioral therapy, family-based therapy, and medication, have limited long-term effectiveness. In fact, I was looking into the article, and it showed that some studies found no clear evidence that these treatments had any significant impact, and any improvements that were shown may have been due to natural progression of the illness rather than the treatment itself, if that makes sense. So, for example, in one detailed study, of cognitive behavioral therapy for bulimia, only 19% of patients were in remission 4 months after treatment. Medication has also shown no consistent success in treating disorders. Researchers are now questioning why all of these efforts have produced such weak results. So one possible reason is that many treatment approaches ignore how the human body naturally responds to starvation or lack of food. So since eating disorders often involve extreme dieting or food restriction, understanding these biological responses may be the key to developing better treatments. So back to my artwork. This is why I did decide to use a woman instead of a man, simply because it is more prone to women, since women are more into their physical appearance and are constantly doing things to upgrade themselves, and sometimes it may not be in the best manner, but of course, as you guys know, they are blinded by that, so they believe they are doing the best for themselves even when they are not. And so that is why I decided to use this. Another thing is that I wanted to highlight the difference between bulimia nervosa and anorexia, since they are often they're kind of used interchangeably, and they're often confused one with another. So let's go into that. So bulimia nervosa shares many similarities with anorexia nervosa. Both often begin after a period of after a period of dieting by people who are deeply afraid of gaining weight and highly focused on being thin. They focus on the food, their body image, and their appearance. Individuals with either disorder often struggle with things such as depression, anxiety, perfectionism, and obsessive thoughts, which is what I did mention about the painting. So they also tend to have low self-esteem and a distorted view of their body, believing they are overweight even when they are not. Both disorders though are linked to a higher risk of suicide and substance abuse, including the misuse of things like diet pills. They involve unhealthy attitudes and behaviors related to eating. However, bulimia nervosa differs from anorexia in many different ways. So people with bulimia often care a lot about being liked and being attractive to others. They're constantly doing X, Y, and Z to upgrade themselves. They are usually more open to romantic or sexual relationships and may have a greater desire for social acceptance and intimacy. They are more likely to have emotional instability, frequent mood swings, and difficulty managing their feelings or just controlling impulsive behaviors. So many people with bulimia nervosa show traits of personality disorders within that realm, especially borderline or avoidant personality disorders. And that is one of the things I found in one of the sources, specifically the sources of Calmer and Calmer. So now let's talk about the physical effects of bulimia nervosa. And how they differ. So unlike anorexia, where menstruation usually stops, only about half of those with bulimia experience missed or irregular periods. Because vomiting, which is a common factor of bulimia, can cause serious dental problems, as I mentioned earlier, due to stomach acid damaging the teeth. In addition, bulimia can lead to heart issues and dangerously low potassium levels, both of which can be life-threatening if untreated. So, to tie it back to my painting, as I mentioned, the teeth issue, the very slim appearance, which is soon to be unhealthy, versus the one that she's actually not, but she does not see that she is very much healthy and perfectly fine, but to her she will never see herself as this. And so I wanted to highlight this topic to show you how this disorder can severely impact someone and change someone's life forever, for the worse. But it could be for the better once they start to realize these things and just whenever reality kicks in. And that's it. Thank you very much.